So my name is Shilpa Gajarawala, and last year in Dublin, I had an opportunity to present on pharmacologic interventions for management in EDS and HSD. And this year, I was asked to come back for non-pharmacologic symptom management. So have a lot to cover, and I added a little bit down there, which Dr. Hakim said perhaps I should make sure I get to the part about virtual reality. So let's keep going. No financial disclosures, but a disclosure out to Fiona, if you're there out in the audience. Fiona, I see you. There'll be no discussion of zinc today. All right, so learning objectives, brief overview of EDS, HSD, and pain management, non-pharmacologic interventions, and a brief introduction to virtual reality as an option. So what do we know? We know symptom management requires multimodality approach because there's so many symptoms and variations among us, correct? No two zebras have the same stripes. Non-pharmacologic approach, which is what we're going to talk about, and then pharmacologic, which is what I talked about. So keep moving here. So thank you to Dr. Daly and Dr. Bluestein for their amazing article. Basically, this is a mnemonic that they have in their article that kind of helps guide treatment. So first M would be movement. Of course, pretty logical. Use it or lose it. So this involves many things, from physical exercise, occupational therapy, speech therapy, you name it. We know that it's important to keep moving and that being sedentary is not going to be helpful. So different strength training options down here. Again, we're going to go through a few of those coming up. Again, I'm going to probably keep saying this and it's going to sound like a broken record, but make sure that whoever you go see, therapists, providers, are EDS aware. In the wrong hands, we can be hurt more than helped. Now, education, the next letter in men's PMS is knowledge is power. And I say power to heal. And this is kind of the backbone of our program at Mayo Clinic, is we want to empower you with education and information as much as we can about HEDS, HSD, and your symptoms so that you can then become the best advocate for yourself moving forward. So utilize what you can, whether it's books, audiobooks, other providers. I think the EDS Society site is absolutely amazing, and I often have my patients refer their outside providers to that. We've had some excellent lectures so far on nutrition and diet, so I'm not going to go too in-depth here, but what's the key here? Low inflammatory diet, right? We want to keep the inflammation down, and we know that chronic inflammation is kind of, I say, the root of much evil, not all evil, but mast cells included, because chronic inflammatory processes have a malignant potential for potential for malignant transformation. So sleep, again, we've had a great lecture on that earlier. So I say bidirectional role. What does that mean? It means that if you're not getting enough sleep, it may exacerbate your pain. And your pain, on the other hand, is going to affect your sleep. And I'll tell you right now, I think I have about 8 different pillows in bed, and I still can't get really good sleep. Of course, optimizing sleep hygiene is also a good thing, which my husband tells me that I have not optimized my sleep hygiene, because we know that you should only be doing 2 things in bed. I won't name them. I think we all know what they are. And I will do anything and everything, work on my laptop, my iPad, watch TV. So I am my worst enemy. So, and we also know the benefits of CBT. So keep going. Now, psychosocial support. So what do we know? The numbers are pretty impressive here, that we know that as a group, we are at higher risk for mental health issues, correct? Psychiatric disorders, 42.5%, 22.7% are affected with 2 or more psychiatric diagnoses, seeing depression and anxiety the most. And baseline general population, right? Depression or psychiatric disorders is only 17.6%. And adding that component of pain then bumps us up even higher, right? For risk of mental health concerns to 10 times greater than others. So now this points 1, 2, 3, 4, 5, 6, and 7. This is what the EDS Society does phenomenally well. Look at these points. Everything on here is what the society offers and supports us with. So again, I'm not going to go through each one just for time's sake, but when you get a chance, kind of look through it. Now, upcoming, different modalities. So I'm going to try to go through some modalities, kind of focusing in, giving you the key points on why they're good for us, or hopefully a little bit about the mechanism of action. So Now, this is a little bit of unpublished data from our clinic at Mayo. Kind of impressive, not surprising. Most reported therapies, physical therapy and occupational therapy, but I will admit I was a little shocked to see kind of the far right end where acupuncture kind of rated low. I'm just curious, how many of you have tried acupuncture? All right, keep your hands up. How many of you has it helped? Still pretty good, still pretty good, okay. All right, physical therapy, any questions here? We know. Physical therapy, physical therapy, physical therapy. It's gonna be beneficial, so. Now, I was practicing my talk, and my good friend who's accompanied me today to this conference, Anne, said, I got to this part, and she just interrupted. She said, that's old school. Why do you have that in your talk? And I was like, whoa, not so old school. It's still used, and it's still very beneficial. So, TENS unit, transcutaneous electrical nerve stimulation, right? Got to be careful with any sort of electrical cutaneous stimulation because our tissues are fragile. But how does it work? It's a nerve gate theory. So large nerve fibers have nerve gates, pain gates basically. And so what the TENS unit does via stimulation is it closes those gates. And by closing that gate, it's kind of control and limit the pain signal getting back to the brain. So again, I'm going to kind of reach out to you again. TENS units, users in the past, current users. All right. Compression therapy. Now, I have not tried it, but Alyssa over here was just telling me how beneficial she found the body braid. So I love compression also. I mainly use it for my arm because I get lymphedema in this arm and my legs after a long day. But what does it do? It helps with proprioception, reduces swelling, gives you more, what do you call it, joint stability, and it prevents hyperextension depending on the type of compression you're using. Caveat here, graduated compression, appropriately fit. Incorrectly fit, it's going to cause more problems than benefit. Yoga. There's probably going to be a little controversy here on yoga because that's why I have gentle in quotes. We know that yoga can hurt us, right, if incorrectly done. So the key here is gentle yoga, keeping in mind that you do not participate in postures or positioning that's going to hurt you or hyperextend or cause hyperextension, excuse me. Find that sweet spot. You want to kind of stay in your safe range of motion. I'm going to reach out to physical therapists out there. Do we agree? Now, Tai Chi, I think, is probably what I would say is one of my favorites, based in traditional Chinese medicine. Slow, gentle movements, used to improve balance, helps with focus, helps with joint stability, so reduces stress and helps with relaxation. I mean, is there anything bad here? Now, if you can't do Tai Chi standing up, definitely start by sitting. Nothing wrong with that, so. Cupping. Had a patient come in, one of her main complaints was, Ms. Shilpa, I bruise a lot. And I was like, oh, well, yeah, that is kind of one of the things that can happen when you have fragile tissues. We'll talk a little bit more about it. And then as we got deeper into the conversation, basically she loved cupping. It provided significant relief, but it caused bruising. So same thing here, cupping can be beneficial. Heated cups placed on the skin, create a vacuum. Vacuum increases blood flow, helps with blood circulation, brings oxygen, nutrients, healing, right? But again, fragile skin, be careful. Heat, too much vacuum, too much suction can cause damage too. So, now acupuncture and acupressure. So we know this is also kind of has its roots in Eastern medicine, one with needles, one without. So you're stimulating specific points in the body. We are talking about acupressure here. So if you don't necessarily like needles, I think acupressure is a good option. Manual pressure, no needles, specific points on the body that basically are triggering or finding sensitive spots or meridians. So we're talking about energy meridians in the body that may be blocked. Again, I'm super simplifying this. So, and again, how does acupressure and acupuncture work? It's also about endorphin release. So, and those are what I call the happy hormones. So, acupuncture, needles. Caveat here, you have to be extremely careful because it can cause bleeding, it can cause bruising. So, but I've had acupuncture and I found it extremely helpful. So I actually had acupuncture for fertility treatments too. So just kind of interesting side note. Go in. For time's sake, we got trigger point therapy. Kind of wanted to mention here that dry needling. So that's something that I've tried that was very beneficial for specific spasms and trigger points. Of course, I'm not going to go too deep into this because sometimes trigger point injections involve other medications, lidocaine, topical anesthetics, and massage therapy, one of my favorites, but it provides more of a temporary relief. Again, release of endorphins, relaxation, many benefits, a bit more short-term, but can be used for acute and chronic pain. So, cold and cryotherapy, again, this is a little bit more about triggering the parasympathetic nervous system if it's something about cold immersion therapy, short-term cold immersion therapy. Yep, I agree, not for me, but a cold pack helps me every now and then, helps with inflammation, actually gives you a little bit of joint stabilization too, believe it or not. So, and heat therapy, one of my favorites, but again, you have to be very careful. You don't want to cause cold therapy frostbite, heat therapy burns. So helps with increased blood flow again, helps with relaxation, improved joint mobility and lubrication at the joint, and overall just makes me happy. So laser therapy, red light therapy has many benefits, but I'm going to kind of skip along here so I don't run out of time. We've had great talks. This is again like the field of dreams. If you build it, they will come. If you think it, it will happen. So what we think affects how we act and feel, right? Thought. Behavior, what we do affects what we think and feel. And of course, emotions. What we feel affects how we think and do. So keep that in mind. That's that intersection. Everything is connected. So keep those thoughts positive. I know there's times when it's so hard to do, but just keep that going. So now, virtual reality. Again, I love to kind of survey the audience. Has anybody here had an opportunity to try any of the virtual reality options out there currently? Cool. All right. Excellent. Friend or foe? Friend or foe, Doctor? Yeah, friend. All right. So where does this come in? Well, patient care, medical training. It's helpful in both arenas. It can help with diagnosis and treatment. It can put us as providers in your shoes, right? So then we can kind of see what you're feeling, what you're doing, how you're limited. Treatment, trial of treatment. I'm going to talk a little bit more about that in a minute. But pain management and pain relief from the patient perspective, because why? It's about immersion, it's about distraction, it's about creating new brain pathways, right? Neuroplasticity. So again, stepping into a new world where your pain actually is going to take a back seat. How nice does that sound, right? So, and medical procedure anxiety. I don't know about you, but sometimes if I'm about to go in for a procedure, I'd like to know a little bit more than just what I had during my preoperative visit, kind of know what's going to happen from whether registration to pre-op holding, where they're going to be putting IVs in, the anesthesia is going to talk to me, actual procedure, post-op recovery, what can I expect at home? I mean, obviously the options are endless here on how it could benefit you. How many of you have procedure anxiety if it's coming up? I think every hand should go up on this one, but all right. And of course, physical therapy and rehabilitation. How often is it that you actually meet with a physical therapist who's absolutely amazing, but whether it's a financial constraint, insurance issues, logistical issues that you just can't get back for those additional appointments, virtual reality would be a great option, wouldn't it? So do it in your own time. And of course, cost might be a limitation on this. So healthcare team benefits overall, training in a simulated environment, right? So you can trial your simple, complex procedures, build up that muscle memory before you're actually practicing on one of us, right? So anatomy and physiology, right? I still, every now and then, can smell that cadaver that I had to practice on. And you only get one try, right? Once you dissect your cadaver, you're not going to go back and be able to do it again. Right, Dr. Francomano? Yeah. So 3D virtual models, we have a human size, it's about 6 feet plus, iPad in our simulation center, and that is what you can do on there also. You can do cadaveric dissection again and again and again if you need to. And empathy building, kind of mentioned that. It's when we step into your shoes. What do we know? That empathetic providers provide better patient-centered care, and who doesn't need and want that, right? Now, global health education, this was a little bit of a shocker. I don't think I ever thought about it, but virtual reality kind of takes away borders for training, takes away the borders for education. From a provider perspective, I may not know what it's like to maybe live through a typhoid epidemic in India, but virtual reality might give me that. So it's going to teach me. It's going to let me witness other things like healthcare disparities and infectious disease outbreaks. And you know what? Make me a better provider because it'll teach me something about cultural nuances also. So benefits in healthcare, like I mentioned, patient education, better able to comprehend your condition, your treatments. It fosters better communication among patients and providers. Mental health interventions, I think, are excellent because you can have a guided therapy through this environment in a controlled manner. So health behavior modification, definitely a place for virtual reality as far as smoking cessation, weight loss, and again, rehabilitation for stroke survivors, amputees, and patients who can benefit from working through a process, working through their symptoms, working through their therapies. So now, gamification I highlighted because I thought that was also interesting because what is this? This is where medical virtual reality programs are tapping into the gaming side of things, where they will have a leaderboard for individuals who've tried this program, and they will have points or badges that you can, because come on, admit it, we all kind of like that kind of reward process. We're going to do something, we want a reward at the end. So they've added this gamification aspect to the healthcare virtual reality programs. Can be used for acute and chronic pain, and I'm down to 1 minute. So I wanted to mention here specifically post-traumatic stress disorder. How crazy, nice, great benefits is this? Exposure therapy in a controlled environment where you have control. So you can say, I want this much exposure. I only want to be exposed for this much time. All right, let me keep going. One of the not so good things about virtual reality is virtual reality motion sickness. So in short, what happens is your eyes are picking up movement, you're in that virtual environment, but your body is not moving. Your brain is kind of going to be in conflict with what your eyes are seeing. And what does that mean? Brain-body disconnect. It can lead to dizziness, nausea, sweating, and headaches. And I'm sorry, baseline, most of us have that already, and this is going to exacerbate that, right? Well, there's ways to come around it. There's ways to adapt to it. And I kind of have this shorter sessions. So instead of having a 20-minute session, try a minute, gradual adaptation, take breaks, movement, add a little hand movement, maybe that'll help. Make sure you're fit well, comfortable headsets. Maybe try a different position. Instead of being upright, maybe try lying down. That might be one way to go. Also have to be careful with these headsets if you already have craniocervical instability, right? You have to take that into account. So, and field of vision. For instance, my field of vision is this big. Think about the sensory input I'm getting from this virtual environment. Whereas if I limit my field of view, maybe that's a better, I can cope better with that amount of information. So again, barriers and challenges, cost, right? It's still very expensive. Education, infrastructure, you can buy the headsets, but then do you have the staff trained? Do you have the money to, say, when equipment breaks, to repair it? Do you have time? Do you have the resources to set up a curriculum for your staff or your department to set this up? And again, it's technology, right? So privacy and data security, HIPAA, that's a concern. So, but I think I'm just going to make it. Quick story, when EDS Society reached out to me to give these 2 talks, I immediately said yes. And my husband, who knows that I have a pretty significant fear of public speaking, was like, are you crazy? Like, why do you put yourself in this situation? But I think what I wrote here pretty well explains it. So when we engage with something greater than ourselves and feel a sense of connection to others in the outside world, it activates the very best part of us. So I want to say thank you to the EDS Society, and thank you to all of you for allowing me in your world so I can be a better version of me. So thank you.